Right, and so do you right. Whichever side goes balance. Talofa Lei, Yorana, Morena, and thank you very much for coming along today. I'm joined today by the Honourable Carmel Cepoloni, who's the Acting Minister for Pacific Communities and is also a member of the Cabinet Committee on COVID-19. Just in time, I'm joined by Lamonga Lydia Sosene, the Chair of the Mangere Otahu Local Board. I've got Josephine Bartley, our Ward Councillor, and Al Filipina, our Ward Councillor, here today. It's with much regret that I announce today that we have made a decision to cancel Pasifika 2020. We have done so after really full consideration. We have discussed this with our Pasifika councillors and our local board chairs. We have discussed this with the Cabinet and the Prime Minister, and we have discussed it with other relevant people in the community, including the Samoan High Commissioner and the Samoan Consul General here in Auckland. Yesterday I had a phone call with the Prime Minister to discuss Pasifika, and again this morning, and also with Minister Cepoloni. We all expressed a desire for Pasifika to continue, but we had to weigh that desire against what might be perceived as a level of risk, not simply to the New Zealand community, but also to the community in the Pacific itself. Overnight, the Cabinet Committee on COVID-19 also discussed the issue, and its advice to Council was that they believed that the event should not proceed. The critical reason for that is not because health authorities have told us that there is a high risk of transmission of COVID-19 should Pasifika proceed. It is because should there be infection at Pasifika, there are hundreds of people coming to our festival from around the Pacific, and they will return to their homes. Weighing heavily on our minds was the history of the spread of infectious diseases in the Pacific, and most recently with measles last year in Samoa, with the taking of 82 lives, most of them young children. We were simply not prepared to take the risk that holding Pasifika might be responsible for that disease spreading into the Pacific, where the health systems and the resources are not sufficient to contain it in a way that we may be able to in this country, and that's really important. The cancellation of Pasifika this year, very sadly, comes for the second time running. Last year we did it because it followed immediately after the tragic events that took 51 lives at the mosques in Christchurch. Pasifika is a great event for us. It's a celebration of Tamaki Makoto's multiculturalism, and it's a celebration of the vibrant and really important Pasifika community in Auckland. In our city, we have the highest concentration of Pasifika people anywhere in the world. So we rate highly the importance of Pasifika, but notwithstanding that, we had to compare our enjoyment of that festival with the risk that this may, even if it was a small chance, that this may result in the spread of the infection into the Pacific. I want to stress, to conclude, that the risk of transmission of COVID-19 in Auckland and in New Zealand at the moment remains low. That is the advice that health authorities have given us. We had to weigh that against the advice that we also received from the Ministry of Foreign Affairs and Trade and the Ministry of Business, Innovation and Employment. And their concerns were very much as our concerns are with what the potential might be should infection arise and be transmitted back to the Pacific. And that is what has made our decision what it is at this particular point in time. This does not mean that all large gatherings of people will be cancelled across Auckland. We will continue to take the advice of health authorities on other major public events. We will continue, before taking any decision, to consult closely with the organisers of those events, and we will continue to take into account what is happening with COVID-19 in New Zealand. We are fortunate, through maybe good luck, but also very good management, to have constrained COVID-19 to 5 cases, all of them involving transmission within families and not into the wider community. But when I look at the figures for what has happened in Italy, France and Germany, which are advanced nations with strong resource bases and health systems, and I see the exponential rise in the spread of the disease in those countries once it takes hold in the community, then clearly, should the situation change in New Zealand, we will be implementing together with government and on the advice of health authorities even more stringent conditions on what events may be held in the future. I'd like at this stage to invite Minister Carmel Sepulveda to add anything that he thinks may be appropriate.
Thank you, Mayor Phil Goff. I think it's just important to state that we endorse the decision of Auckland Council, that it has come about through discussions between the ministers and Prime Minister who are part of the coronavirus or COVID-19 committee, and that it is based on information that we have received from different government agencies. So, along with Auckland Council and the Mayor, we are sad that this decision had to be made, but we think that it is the responsible decision, and our primary consideration has to be for our neighbours, the Pacific countries themselves, and that is the basis of this decision.
Thank you very much. Unless any councillors want to make a comment, we'll just open it up for questions.
When you talk about things may get changed in Auckland, what things are you considering at this stage? What things are you modelling and what predictions have you got?
Well, the government, of course, which has the overall responsibility for the whole of the country, including Auckland, has a pandemic contingency plan that would be put into place. So they would be making the big decisions. And what I've been very pleased at is the very proactive stance by Ashley Bloomfield, Director General of Health, and the government in anticipating rather than waiting for developments, and I think that is important. Here in Council, we've put in place our own provisions, particularly in relation to staffing matters and staff that may have a common cold or may have ordinary influenza, for example. Can't really tell the difference at the early stages from the symptoms, are told to stay at home and to work from home. We've lifted the levels of advice and hygiene within the building. So you'll see the hand sanitizers, you'll see paper towels in the restrooms. We have lifted the level of cleaning in public places and through organisations such as Auckland Transport. But if need be, all of those measures can and will be ramped up should there be a wider spread of the COVID-19 in the community. At this point, we are very satisfied that the spread of the disease has been constrained, but even with the best measures in the world, we've seen countries that have suffered far more infections and fatalities that we haven't seen yet in this country. But we need to be, and my understanding from health authorities, we are ready in that instance.
So what are you looking at in Auckland? Are you looking at closures and a more consistent Sparkarino? So
what I've said, and I'll repeat it because it's quite important. We are judging the public gatherings on an event-by-event basis. The health authorities' advice, which we put great store by, continues to be that the risk of infection at such gatherings is extraordinarily low. But if there is a particular situation such as this one where there are other considerations to take into account, such as if there is an infection And because there is a large number of people coming from the Pacific to this event, and it's carried back to their countries, what would be the impact on the region? And we are not prepared to take that risk with the disastrous consequences that would follow.
I suppose my question was, are you looking at big ticket items in the future, the possibility of
If the situation were to deteriorate and there were to be people-to-people transmission across the community, yes, then of course we would look at events in the community, and the government would be looking at things like attendance at school or health authorities. I want to stress, because I'm not here to induce panic, that we have not reached that point, and we hope not to reach it. But should there be contingency plans in place? Of course.
The Prime Minister received advice earlier this week, I think on Tuesday, from health officials, and was told that big events like the Pasifika Festival and the Memorial Service in Christchurch could go ahead.
Yes.
What has changed exactly between Tuesday and now?
Well, I'll invite
Sure.
Minister Cepoloni to talk to that, because she is on the Cabinet Committee.
So the health advice stands in terms of large-scale events still being able to go ahead as long as the public health messages are put out there and all of those types of guidelines are followed. The difference with this event is that MB advice indicated the large number of people that were likely to be in attendance from the Pacific and therefore travelling back to the Pacific. And the large nature of the event, keeping in mind that Pasifika would have been the biggest event held in New Zealand this weekend, with around 60,000 plus people attending, would have meant that contact tracing would have been incredibly difficult. And then also, if someone was to attend and it was caught and taken to the Pacific, it would be detrimental potentially. And so that is the difference. We of course accept Ministry of Health advice, but we have advice coming from other agencies as well. And the MB advice on this was integral to the decision that we've made today.
It seems like quite a drastic decision considering the threat of community transmission remains low.
We don't want any regrets, and as the Mayor has said, it is for all of us quite heartbreaking that we've had to make this decision, but the call had to be made. We know the challenges in the Pacific in terms of the resourcing and the health infrastructure in general, and we also know the challenges in terms of the health conditions that our Pacific people in Pacific nations are more susceptible to or have high proportions of, including things like diabetes. And so it makes those populations much more vulnerable, and we don't want to be in a position where we're hosting an event here that could lead to the spread of coronavirus to the Pacific region.
All that considered, looking forward to next weekend with Polyfest, has there been any advice you've received from Mayor Phil Goff about that?
We are still talking about what may occur in regard to Polyfest. I think the key difference is that we believe that it's much more likely to be a local event rather than an event with people coming here from the Pacific. But we are still considering advice. We are determining whether there will be any international attendance at that event, and we have yet to talk to the organisers of the event. But that is due to take place next Wednesday, so there is some urgency in the advice that we're seeking on Polyfest itself. Can I just stress that in backing up what Minister Cepoloni has just said, yes, we are being precautionary here, and I think when I talked to the Consul General from Samoa, Fa'aolotoi Pongi, he used just those words. Yeah, it's better to be precautionary than to run the risk in this event, and Samoa certainly understands, and Samoa is taking quite strong measures of its own to ensure that this infection does not repeat the tragedy of last year with the measles epidemic.
What other conversations have you had with Pacific government? Is there any other formal requests you may have received?
I'll get Carmel again to talk about governments.
So I have spoken directly to the Samoan High Commissioner, who is also the head of the diplomatic corps. High Commissioner Leasi Scanlon, he supports our decision here for the reasons that we've outlined. Also, we have spoken to some health professionals, so I think including probably the leading Pacific public health professional, which is Dr. Colin Tukuitonga, and also the the Chief Executive of the county's Manukau DHB, and at this very moment the Ministry of Pacific Peoples is having a meeting in Manukau with a room of health professionals from the Pacific sector as well. So there has been a number of conversations had.
A question, and I'm not sure if I would like to answer from Mark Takata, their friends who couldn't be here, but with Māori and Pacific often suffering so badly in health statistics, any advice for them during all this?
Oh, I don't. That may be something for central government.
Yeah, I mean the advice that's been put out there publicly, the public health advice is what stands. It is the need to ensure that we wash our hands, the need to limit contact, which can be very hard for our Māori and Pacific communities when you see each other and are so used to greeting each other, whether it be with a hongi or kissing each other hello. But we are trying to take leadership as well in these situations and encourage people to greet each other in different ways. And so those are some of the messages that we need to be continuing to put out to all New Zealanders, including Māori and Pacific.
And can I just add to that? For our Māori and Pasifika families, communities, we don't go to the doctors, we don't seek any medical attention when we don't feel well. And so this is just a reminder that if you are not feeling well, ring the healthline number, ring your doctor, get some advice and follow it up. Just don't sit on it and stay home. But do something because as the statistics show, we are the most vulnerable in terms of health and well-being.
Sorry, can I just ask about Polyfest again? Just because you cancelled Pasifika, but Polyfest is such a way bigger event, and it's like 90 to 100,000 people come into that event. And I do know, because sorry you said, Mayor, that you don't know if international groups are coming, but they're starting from Hawaii, Tahiti, and Canada. So I'm just wondering whether it's like, do you need to be talking to these people quickly? Yeah.
That's exactly the advice that we're seeking at the moment, and we need to have discussions with the organisers before. This is not a case of making a unilateral decision. We need to talk to the organisers of that event, and we need to ascertain the levels of risk, including transmission back to the Pacific. Those are important factors.
So can you guarantee at this stage that Polyfest will go ahead?
No, of course not, for the reasons that I've just given. We have not yet got all the facts that we need to make an informed decision on that. We have not yet talked to the organisers, but the decision that we make, you can be sure, will be a decision that puts the health and safety of people at the forefront of our decision making.
This is the second year in a row that this event has been cancelled. Have you spoken to groups, members of the community who are involved, and how are they feeling?
We've talked to Councillor Philippina has been talking to some of our hardworking people in AT that have spent the last several days setting up in preparation for the event. And there's a huge disappointment there, but I think an understanding of why the decision has to be made. Right across Auckland, the 60,000 of us that turn up, then I turn up every year and all my colleagues up here at the event. It's hugely disappointing for us. It's an event that we love. It's a celebration of something that's special about Auckland. But these are special times, as was last year. And last year, it was with huge reluctance that on police advice that we cancelled. On this time, it's taking all of into account everything that needs to be taken into account, weighing against our simple desire to have an event that we can celebrate and enjoy. And I think, the people that I have talked to since we've reached this decision, there is an understanding that we have to be precautionary and that we have to put health and safety concerns first in this instance. These are special times, unprecedented times.
Can I just add, from our Pasifika community perspective, we understood the reasons for cancelling last year out of respect for our Muslim community. And this year, we are going to understand the reasons why this is being cancelled. We do know that there's disappointment because it is such short notice, and there are already people that have flown over here from overseas to sell their things at Pasifika. But again, the reasons are completely understandable.
Can you estimate how much money has been spent?
I've asked that question. I haven't yet been given a figure, but whatever the figure is, money was never going to prevail over the health and well-being of all of our people. Okay, I think we've probably reached the end of questions. Thank you very much for coming along today. Cheers.